Well, I'm really honored that Linda's here, and Linda and Richard are sort of iconic. They work together so well. Um, and one of the things that really struck me is that how Linda and Richard are really working hard to be independent for as long as they can. And I think one of the best presents that you got from your daughter is a personal trainer that comes to your house once a week or so. So we're going to talk about, the importance of muscle building and how to be independent and see how important that. But Linda, tell us how I first met Richard and how we got together.
Well, that was in years ago. You were at the Hamilton General Hospital where you were working, and Dr. Magna at the time sent Rick down to see you because he figured there was something wrong, wanted to make sure Rick was okay, and we just stuck with you ever since. It's been worth every penny of it.
Yeah, it's been I can't count that long. And one of the things that I'm just in honor right now is that I was talking to the group is I fell asleep on the GO train at Aldershot at 1:30 in the morning early this morning because I was coming back from my 40th class reunion from medical school, and I think I was a part of the best medical class. We were 160 of us, and I think most of us still curious. We're still working away, and we all feel very grateful that McGill gave us the opportunity to learn and start our medical careers, and to look after you, Linda and Richard, has been a real honor. So tell us more about this picture here.
Which one? Oh, that's my son when he was younger, and my daughter at her when she was getting married to my wonderful son-in-law. I've got two wonderful son-in-laws, two great daughters, a son. I've got four grandchildren, which are two boys. One's a graphic artist. The other one works for the University of Toronto. Two future granddaughter-in-laws. One, the other one isn't, and two great grandsons. One just turned a year, and the other one's about 4 months, 5 months old.
So having, one of the secrets to longevity is having as many good quality relationships, and sound like you have quite a few. And you can see here's in my office here, and you can see what a clean, neat office, everything in good order, and it's a nice.
I got news for you. You should see my house for moving, and it looks more like a bomb went off. And they seem to be well, fine. They'll keep coming in saying, "Have you got this ready?" No, I haven't got it. And then my daughter that you've met, she brings in her dog, and I kept my granddaughter's cat, and we're doing okay. We'll get there sooner or later. And if we
Nice.
don't, we don't have to worry.
Okay. And I think you were saying an interesting comment that they said your appointment was going to be later on, and we just saw you earlier. Is that right?
What do you mean now or later? I
And
do
then,
have an appointment.
no, initially, way back when, is that
Oh,
you couldn't get an appointment for a while, but we somehow got you in earlier, did we?
yeah. It was funny because Dr. Magna had said, wanted you to see him, and he was telling us all about this Dr. Curnew and everything. And then he called and he said, they called and said, I got an appointment for you. And I think it was about April. And I kept getting a call from McMaster saying, you can't see Dr. Curnew until September, such and such a date. And then they would call back and say, I have to postpone it for another 2 weeks. And it was by the end of September. And I said to the lady, don't bother calling me anymore because we've already seen Dr. Curnew. You have, she says. And that was the end of the subject.
Yeah. So what I try to do is fit people in it's about 9 o'clock, and I still have some work still to do, and it's always a pleasure to fit people in when we need to. So that's one of my priorities is to do that. So I really feel grateful. Tell us about the next slide. What's next? So medical history. Morgan, do you want to tell about this? You want me to talk about this? What's the best thing?
Yeah. If you want to talk about it, that would be great.
So, Richard has had problems with some falls. His blood pressure is sort of being 100 to 120. Cholesterol, easy thing to treat. He has some degree of congestive heart failure. We found that his heart muscle is being damaged. We have his ejection fraction is somewhere between 45 to 50%. Normal is about 55%. We found that he had a heart attack on the back wall of the heart. And one of the things is that Richard's become a little bit frail as time goes off, and we want to make sure there was no rhythm disturbance causing this. So one of the things, he has something called winky back. It's a form of heart block, but not a serious type of heart block. And we found out that his horsepower is about 4.6 met. So he's limited. And one of the things is deconditioning, is that so his heart still is injured, but still pumping away. His rhythm is still working. It's not 100%, but he's not going to benefit from more interventions at this point in time. Is trying to build his muscle strength at this point in time. Sarcopenia is a medical word saying that as we age, we can lose half our muscle mass between the ages of 30 and 70, and that you want to build muscle. And the same thing, Lynda, you have your blood pressure is at a very respectable number. And I'd love to have low blood pressures. You've had, I think, 2 blood clots. You're on blood thinners. You have diabetes. You have some kidney dysfunction. So you have these medical issues as well. And I remember a discussion with your daughter saying, is how do we get you stronger? Because when you hear numbers that you lose half your muscle strength, half your muscle mass between the age of 30 and 70. What can you do about that? Well, the first message is don't grow old. But if you do grow old well. And I think one of the things is that she got a personal trainer to come to your home once a week or so. And that's been instrumental in your guys' success. And we'll talk more about that. So, is that, and I saw a person today who's weak and dizzy and can only do about 1.1 mets on a stress test. So 1 met is your basic metabolic rate, and she's dizzy and weak. Her heart's good and strong. She has no rhythm disturbance. She's just deconditioned. And so building fitness. I'm building fitness. I know Rad's building fitness. He lost some weight doing marathons. And Morgan's going to beat the hell out of me in the CN Tower climb in a couple of weeks from now. So my strategy is to grab put a leash onto on Morgan and to Rad, and hope they'll pull me up. And at the end, I'm going to just pole vault over them. Is my strategy. But no, I'm just going to enjoy climbing and see if I can keep up to that. And so I'm going to have some fun doing that. Anything else you want to mention about your health there, Lynda, or that of your husband's?
Well, I remember why he came to you in the first place just now. He came because he had high cholesterol.
Yeah.
And you pointed it out what to do and everything. So that's why we came to you. Otherwise, I hope that every time I go, you give me all those tests, I want to pass them all, because I don't want to hear you saying to me, oh, you can't do that. And I'm going to do it. And he's doing what he can too. And that's the main thing.
Yeah. So you can see that, is that if I was going to stop at the cholesterol, we would have missed his heart attack. We would have missed his progressive frailty. And then we decided to include you as part of the package because you guys work together so effectively. So that's really important. Yeah. So we'll look at how everything fits. Yeah, go ahead. Yeah.
You're just going to say that up until this happened last October, he was, I would say, not fit, no, but he was able to do and live a regular life, and we did a lot of things. But now it's sort of not everything, but he's making progress, and that's the main thing. If you had said to me last December when he came home to now, what would you say his percentage? I say he was about 80, maybe not quite 80%, maybe 80% improved. So consider that when he come home from the hospital.
Nice.
And that's the exercise is doing too.
So what happens is as we get older, we get an acute illness, we get hospitalized, and we get sick, and we lose so much of our reserves. So within a couple weeks of being hospitalized, we can lose over 25% of our horsepower, and it's always hard to bring that back. So that's why you want to have lots of reserve. It's sort of as Rad will tell me, is that you want to put money aside for a rainy day, so you grow your RSP, your financial savings. So same thing. I'm trying to grow my health savings. Yeah, good point. Thanks. But you want everything into context, and I like how all the body connects. We're gonna play a game. What's
All
gonna
right.
okay?
Yeah,
Okay.
so the game is a true or false, and I'm gonna be asking Linda the questions, and Linda can, try your best. It's okay if you get it wrong, and then we'll be going over what the answer is after. So the first question is, and I think Dr. Curnew did mention it earlier, but after age 50, we start to lose half our muscle mass. Is it true
True.
or false?
True.
I'm gonna actually say it's false because it starts around the age of 30.
Oh, really?
Yeah.
That
What,
might,
what's the,
that might explain a lot.
what's the answer? Oh, look at that.
Yeah, it is false. Yeah. Yeah, like you said, like you may start to even lose muscle mass after age 30, and studies have found that you might lose like 3 to 8% per decade, and you might lose up to 50% by the time you reach age 70. So,
Hmm.
yeah, important to start early for
It
sure.
does accelerate as we get older too as well. Yeah. Yeah.
Yeah.
Okay. I like that question.
Okay.
That was a trick question. Good question.
Yeah, some of these are worded particularly. Okay, next question is, older adults should avoid resistance training as it may injure the joints. Linda, what do you think?
Should resist it? No, I think they should try it. Maybe, but I think they should try it. And if it's too bad, then they have enough sense to stop it.
Do you understand
Or like me,
what's resistance training to you, Linda? What does that mean?
go to some that's like say a wall, and you lay up against it and you push on it, but it's not going to give, but you are.
Yeah,
So something like that is it's where the immovable object doesn't move and you're the one that's moving.
yeah, so it's basically lifting weights and bands and push-ups. So basically, either you're lifting against gravity in some way. So you're pushing the wall. If you can push through the wall, that you're really strong, or you have a bad wall. Another form is lifting weights or push-ups. You're lifting your body.
Yeah,
And
I do that one on the lift up my hips and everything, and I brought my weights up. Rick uses a 2 pound. I don't know if you can see it, but it's a 2 pound weight for Rick. You
okay,
need 10. And for me, Marco thought 2 pounds was too light, so he brought me my 5 pound weight, and I used both of that.
nice.
And it's this heavy.
And it turns out, in my mind, is that one of the best ways to improve your joint pain is to actually exercise the joint. You have to be careful. You
Yeah.
can exercise and damage the joint, but you can actually exercise, strengthen the ligaments, strengthen the joint, and make it stronger and less painful.
Yeah, well, I found that too, because I found that when I was doing the exercises until our trainer went on his honeymoon, I found that I could do a lot better. I didn't have trouble. My back didn't bother me like it usually does. And my legs felt like I was all right to go up and down the stairs and everything like that. And since I haven't done it, because of, as I say, we did some of his things, but I didn't do all of them. I do find that my back is bothering me again and my knees are bothering me again. So when he gets here on Friday, I'll say my back is bothering me and my legs are bothering me, and he'll make sure I get the exercise to do them.
Nice. So we'll see what Morgan tells us. What's the answer, Morgan?
Yeah, so we said false. It can actually help with joint pain, things like arthritis and slow mobility declines. So if you're kind of building up, say, leg muscle, even if you're having a lot of weight that's kind of putting some strain on your knees, having that like leg muscle or lower body or things like that can kind of help you with mobility and things like that. But Rad has found a trial that kind of helps explain this.
Yeah. Thanks for that, actually, just in time. So I was listening to somebody called Peter Attia. He was interviewing an expert on bone health and postmenopausal women, and I heard her reference this trial, the Lift More trial, Lift More without the E, and you can see the title and what they found, that heavy resistance training is safe and improves bone function and stature in postmenopausal women with low to very low bone mass. So that's very interesting that this was not just the average person.
Yeah,
And the
yeah.
average age 66. And so you can see people with osteoporosis. That's one of the big things you can do, and not just in youth. And by youth I mean 40s, 50s, but also in old age, senior age. 65 and above. Um,
Thanks
Beautiful.
for sharing.
Absolutely. Take it away, Morgan.
Okay. Yeah, next question. Okay, so people aged 18 plus are recommended to get 150 minutes, so that's 2.5 hours of moderate exercise per week. But do adults aged 65 plus, do they require less?
No, I think it's false.
Okay, yeah, you're right. Yeah, the answer is false. It was recommended, I know the government of Canada and also the World Health Organization, they did recommend that adults 65 plus still do exercise for 150 minutes per week, moderate exercise, and try to include muscle and bone strength training at least 2 times a week.
So it's interesting, this, how much you should do and things of that nature is that, if you just backtrack, one slide there, for me, what I'm trying to do is that I do, 2 sessions an hour long with my personal trainer, my group. I also do another couple more sessions, with, with my squash buddies and on my own and things of that nature as well. So I'm trying to do at least 4 sessions a week, and I'm trying to do some aerobic balance training exercise as well. So I try to actually devote 10 to 14 hours a week of this form of activity if I can, and to me it's like fun, as well. So it's also like there's squash involved, there's maybe some swimming, sometimes cycling, hockey. Oh, I forgot. I'm back to playing hockey. So I think I'm the worst player in the entire league, and I'll keep trying. But and so far I'm averaging 12,500 steps per day this year so far. So I actually figured out how many steps I've done. Over 3,800,000 steps so far this year, if I got that right. But I don't consider it necessarily work. It's a joy because it helps, manage my stress levels. And I keep saying I'm going to train for the CN Tower climb. I'm never really good at that, but I'll keep working at that.
Well, as for me, I've been packing and getting things ready to move. I pack the car, take the stuff over to the apartment, undo the car, take it back and forth. And I still got a lot more to do. And I find too that, as I said, we have my granddaughter's cat, which I've been keeping. I keep it as my thing. So he weighs in pretty heavy. So when he has to go to the vet, he likes to put the back end, which is the heaviest, at one end of the cage. So I have to carry him from the car up to the vets, back to all the. So it's not, it's not a lot, but it keeps me moving, and I'm doing things around here, and I go up and down and do my exercises. So I try to do as much as I can and not really do heavy work. But as I say, it's just what I'm doing, and I feel a lot better for it. I really do.
Nice, good.
Yeah, and you were saying your cat is like 26 pounds, right? So that's quite a weight to lift. Okay.
Oh, I think we just lost you again.
Okay, no, I see you. Yeah. Okay, I think this is our last question, but you need high intensity workouts or heavy weights to see desired results. Do you think that's true or false?
I think it's false.
Yeah, you're right. Yeah, for sure. Low intensity workouts can also like give desired results, and desired results can vary between person, obviously. But we're going to be diving into your story about how you don't need to try to be like a extreme bodybuilder to get really good results. And studies have shown to be effective, that low intensity exercise can be effective in improving balance and lower limb muscle strength.
So Rad, we were talking about this a little bit before about intensity, repetition, weight, height, weights that nature. How do you put all this together? Like you have to build power, you want to build strength, you want to build endurance. How do you?
I want to build strength because I'm the one that has to do most of everything now. And Rick is trying, but at the same time, I don't think he'll ever get as strong as he was before the accident, the fall. And I just lost you completely. Can you hear me?
Yeah, we can hear you.
Okay, I can't see you, so Matthew went home, so I can't do anything.
Yeah,
But
we can see you. You're great.
Okay, so what I want is the strength, so I can continue doing things that I normally, that Rick would have done. And now I have to do it, so I'd like to get strong enough that I can say, bring in all the groceries or take him go on a trip, and I do the lifting of the luggage and not him, things like that. I just want to be strong enough that I just keep on moving and moving and moving and not go any place that I shouldn't go, if you know what I mean.
I kind of wish that I started my strength training program when I was in my 20s. I did lift weights for maybe a few weeks, a few months when I was part of the rowing team, but I never kept up with that. So back then we were concentrating on more on aerobic capacity, building stamina and not building strength. But you're absolutely right. And probably if I had to pick, um, probably strength training is probably more important than the aerobic capacity, because you point out, because you want to live your life, Linda, right? So if you don't
Right.
have the strength, you can't live your life.
I used to belong to a gym, and I would go and I would think, and the more I went, the more it seemed like I don't want to do this anymore. I don't want to do this anymore. So I stopped and I let it go. But now the way I'm doing it, it was more harder then. Like when I would get on, say, the treadmill,
Yeah,
and the
yeah.
first thing come out of their mouth was, "It's too slow." Well, I was doing what I want. They would check it up, and I got to the point where I just thought, "This isn't worth it. I'm not. I'm coming out of here feeling 10 times worse than what I went in." And so now with Marco coming in, it's not strenuous. It's easygoing, but you're learning to get that strength back that you sort of lost. So that's
Nice.
the main thing.
Are we going to talk? Are we going to show a picture of Marcos later at all, or mention him at all?
I've lost your picture completely, so I can hear you. Marco, I'll, I don't have a picture of him.
Who is
I,
Marco? Tell me about it. Tell us about Marco.
Marco's a young man who's, I guess he went to University of Toronto for, is it kinetics? For exercise, for things like that. And,
Yeah.
and he just got married and went on honeymoon. That's why we're behind. He comes in, he's very friendly, he's soft-spoken. And when you don't want to do something, he just says, "Oh, really? 10 more times." And he gives you this big smile, and you feel you have to do it. And he's really a nice young man, and he's really working hard. And I said that to my every time my daughter comes home from being with him for an hour's exercise, she comes in and she says, "He really worked the heck out of me." And that's not the word she used, but that's what she said. And I said, "Oh, what's he do?" And then she was here one day when he was doing us. And she says to him, "Why don't you do that for me?" He says, "Because you're younger and you can take it. And they're older and they should just take it easy." And he does it but he does it in such a way that makes you feel, "I want to do it." Every
Nice.
time I said, "I don't want to do it," he just smiles. And I say, "I know I'm doing it." So he's very easygoing. And that's the main thing. You
Nice.
don't want to feel like you're being forced to do something.
Nice.
It
And
just
what about these pictures here? What do they represent here?
I can't see it, so I can't tell you what they are. And Matt went home.
That's okay. And so where I get young people to help with technology. So
Yeah, well,
uh,
my
so
idea. Okay.
so so Richard, he was a pretty independent guy. I see. He worked as an accountant, did all the banking, paid all the bills, and did he do much
Was
exercise?
He was a coach and he did soccer. He belonged to the Hamilton Soccer,
Nice.
uh, Mount Hamilton Soccer. He got in there well, it was my fault. He went over to sign our son up when he was about 4, and they phoned up and said, "Oh, they're on." He said they asked if there was anything, a parent would volunteer, and they said, "What does your husband do?" I said, "He's an accountant." She says, "Really?" And next thing I know, I went home and he says, "I just got a telephone call from Mount Hamilton." I said, "Yeah." He said, "They just asked me to become a coach." I don't know anything about soccer, but he learned, and he belonged to the Hamilton and district, and he did things like that. So he was always on the go. And he
Nice.
played basketball, and he played basketball, and he played baseball, basketball, and he played tennis when I met him.
Nice, nice.
And then he gave it up.
Okay.
Yeah, so yeah, we can kind of start to go over some of the health challenges that both Richard and Lynda faced, and going from October 2023 to January, especially. Yeah, so Richard had a fall and he had a concussion as a result. Lynda was telling us how they were preparing to go to bed and they didn't really notice that anything was wrong. But just suddenly, as like Richard was kind of like just like walking, there wasn't anything in his way or that caused him to fall or trip. He just like suddenly fell and like fell forward and like smashed his head on the floor. And yeah, Richard and or Lynda and her son like got into the hospital, but he stayed in the Hamilton General Hospital. But the thing is, he actually fell again. So when they sent him for an ECG and cardiac testing, the team actually like left him alone in the testing room for a while. And when he was there alone, he actually fell off the stretcher, and he actually got a second concussion. So he had two falls within 48 hours, which is really shocking. And he was
Actually,
actually
28 hours. It
Mm.
was 28 hours before the two between them. Hello?
Yeah, we can hear
Are you-
you.
Oh, okay. I
But
didn't
yeah,
see it.
Yeah, he was on bed rest for 5 weeks.
Yep.
Okay, next slide.
All right. Yeah, I just wanted to cover, you just mentioned bed rest. Lynda, I was gonna ask you, so after he came out of the hospital, how was his strength level?
Very, very weak.
Yeah.
They kept him in bed. And then they asked if he'd like to go to Jaravinsky for rehabilitation. We said yes. They said they were booked. I said, well, they have enough programs. They said, yeah. I said, well, I'll drive them back and forth. They said, oh, no, that'll be months to go. So we'll send them down to the general rehabilitation. He goes down there for 3 weeks. And I said, when's he going to, I asked them when they were getting a rehabilitation. They said, oh, he didn't have a stroke. So therefore, we're not giving him any.
Yeah. Well, your
So they
story is
sent
a
him home.
testament to this, Lynda and Rich, that people who things happen in life and you have to be in bed for whatever reason, injuries, sickness, falls, and people lose muscle mass when you don't suddenly stop doing something. And this was a research paper showing 2% muscle mass loss per day, and these are people in an ICU. I know Dr. Curnew mentioned what these little things are on the top, right? Now we have them. So they looked at rectus femoris, the big muscles in your legs, and the thickness, and that declined. So every day, muscles lost, and on the left side, you see how much muscle you lose over the decades. And we already mentioned that previously as well.
Yeah, he lost a lot of muscle mass. I mean, he's not going to be back to where he was before the accident or the fall, but he's making a lot of progress where he's still doing it. He can walk. He likes to only walk with his cane. I get a little perturbed about it, but I want him to be safe. I do worry that he might fall again, but he goes in and out of the house, gets in and out of the car, doesn't do a lot of grocery shopping or going grocery stores because I'm worried that he'll fall, and he sometimes just wants to sit there in the car. But otherwise, he's, you know, he's getting more muscle compared to when he come home to now. He's got a lot more muscle mass than he would have had then.
Yeah, and he has more strength, as you said. And so essentially, most
Yeah.
people continue to decline. I think the majority of people, when something like this happens, falls, things tend to get worse. And at best, things just kind of stabilize, if anything, if that's good news. But in Richard's case, he's improved a little bit. He's been working with a personal trainer. He can get up from the chair slightly easier. And those are extremely wonderful, functional things that you want to see. Especially in the elderly getting up, as you said. And so it's wonderful news, and that's why I liked your story in particular, because it's a story of success to some degree, and an inspiration to people, anybody listening, parents who are elderly, that you can do something. Again, not saying everybody can make a recovery, but try. I think a lot of people lose hope.
Here's what I think, and this is my own personal opinion.
Yeah.
We went down to Dr. Curnew's office and he looked him over and he said, he needs to get some get exercises, and he gives suggestions of what to do. Sandra had came with us, and she said, I think I'm out loud. She says, I think I'm going to get my trainer to come in and see him. And I thought, oh, sure, yeah. So she got, next thing I know, she says, Marco will be at the house, and Fridays at 4 o'clock, he'll be coming and help me. And sure enough, he did. Rick's doing a lot. He doesn't like that walker. I'll tell you right now. He doesn't use that. He only uses that to get out of the chair. He still has a bit of problems getting out of the chair, and I do help him, but he uses a walker for that. That's the only thing he wants to use. He uses and he won't use a medical cane. He wants this stupid cane that I bought for myself as a joke, and he uses that. He uses it up and down the stairs, all over the house, in the apartment. And the apartment, as I said before, the apartment from the fire door to our door is a very long hall. And I notice every time he goes in there, I notice the difference that he's not wobbling, he's not leaning, he's walking pretty normally. And he opens the door for me and everything. And I'm really very happy to see such an improvement. And I think it was because of the exercises. And thanks to Dr. Curnew, who suggested he get some exercises. And I'm very grateful for that.
Well, I'm very grateful for your daughter who got her personal trainer to come to see you guys once a week. That to me is the most precious gift I think she's given you.
Oh, yeah.
I mean, I wish more people would do this. I meet so many people that their lives are just holding, at bay. They're just tinkering on following. You mentioned this slide tells us, remind you, if for every time you're at bed rest, and let's say you're in the hospital, you're sick, or even at home being sick, you can lose 2% of your muscle mass per day. It's going to take a long time, if ever, to build that up here. And this just shows that you can see the decline by decade, 42 and 31% in males and in females. So this is serious stuff.
It is very serious. It is so nice because now he walks up and down the driveway, and Marco's comment was, you walk to the corner, you cross the street, you go down the other side of the street, you go to the corner, come back up, and maybe once or twice. Then he says, and then by the time in 2 months, I want you walking all the way around the block. Well, since we're moving into an apartment, he'll be using the hallway up and down continuously. And it's the best thing for him. It's wonderful to see him move. He does it. He gets up and does everything himself. I mean, the only thing they still do is send a PSW in because when he gets near the shower, he starts wobbling, and I'm afraid he'd fall into the shower. So they've still send it in, and that's the only only extra help he does. He tries to help me do housework. He'll always say, what do you want me to do now? And I just say, do some exercise, get up out of the chair. I don't have to take him to the bathroom. I don't have to do anything, but he doesn't like me driving the car, and he likes to point out that I'm driving terribly. That's okay. But he'll go, I'll say to him, if we're going for groceries, I will say to him, do you want to come in or do you want to sit in the car? Now, if he feels like he wants to come in, I give him the push cart and let him push the things around and we get the groceries. If he wants to come in and doesn't want to go around this grocery part, I just try and stick him at the McDonald's and give him a pop, and I'll be back in about 20 minutes. And he says, okay. He gets up, drinks his pop. I know he's got an apple pie because that's right in front of him. But I know he's been up and he's doing it. So I'm quite happy. The only thing that really, I think, bothers him to a degree is he can't drive the car. And every time he asks me why, I say, Dr. Curnew said you can't drive the car right now. And that's the end of the subject.
So it's kind of interesting is that I lost my train of thought. But anyway, keep moving forward. Let's keep moving forward. Tell us more.
Okay, yeah, sure. So
Oh yeah, I'm sorry. Here's what I'm sorry. So one of the things that who should have a walker, who should have a cane, and things of that nature is that we all have a lot of pride, but you don't want to fall and break your hip. So really talk to your healthcare team. Who should have a walker? Who should have different devices. They can mean the difference between independence and falling and breaking joints and things of nature as well. I know we all have our pride, but sometimes you gotta put your pride away and use things. So, and there's physiotherapists that can help us, occupational therapists that can help us, experts in this area that really can make a
Well,
difference.
he will use the walker, but I think, as you say, it's pride that he can do this, because if you had seen him in January when he went for a CT scan, and it took 4 people to get him in the car, and it took 5 to 6 people to get him down the stairs to the bed, and him doing this with the walker, not the walker, with the cane, I do worry about it. Don't get me wrong, I do worry about it, and I keep taking it. Well, you can't lift it. Well, I can fold it up, throw it in the trunk of the car, and off I go. But he wants to do that exercising, and Marco tells him to use the walker, and then he'll walk with the cane, and Marco will say, no, 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 we use the walker. When we get stronger, we'll talk more about using the cane. And he listens to him. And that's the main thing. He's listening to somebody who knows what they're talking about. If I said to him, you can't do that, he'd do it anyway. But with Marco will say to him, you need to use the walker right now. So he uses the walker, but he does let him go up and down the stairs with the cane. And he comes up with him, he comes down with him. When he goes up the stairs, I turn around and I walk behind him, and he always says, why? And I say, because if you fall down, I'm there. And he says, yeah, but I'll land on you. I said, yeah, but I'm a lot easier to land on. So let's go up and down the stairs. So he does that. And I'm so happy that he can go up and down the stairs. And I'm so happy that he can do 90% of what he did before. I mean, the only thing he ever did lately was he tried to pay some bills. And he put too much money in a Visa account. And then he put more in there, and I had to try and get it out. Well, the bank got it all out for us. But the point was, he tried, and that's the main thing. A lot of seniors that I see when I go out sometimes, they don't want to try. They just look at you and, oh, I can't do that. I can't do that. Why not try? I mean, I'm not saying you're going to be fantastic or that, but try and make yourself feel like you can do it. Some of them just give up and say, okay, that's it. I can't do it anymore. So I'll let somebody else do it for me. And that's not me. I just keep going, because I know if I don't go, I'm going to have a real big problem. And that would be, I'll lose my mind and all the rest of the stuff. So this way I keep doing things that I like to do. And I like to see him, he's doing what he can. He's trying to think. He's trying to, let me help you pay the bills. Let me help you do that. Then he does forget. Don't get me wrong. He does forget. And then he'll say, oh, darn it, I forgot it. And oh, that's okay. Don't worry. We'll get it all straightened around in a few minutes. And he does. He just listens and he lets it go. And I'll say, all right, now let's do this again. And he will try again. But it's just that I look at so many, like I have a neighbor across the street who's had hip replacements on both hips. He lives with his daughter and his 2 grandchildren. And he comes out and he barely walks. He's losing it. And I can't do this. I can't do that. I can't do this. And I think to myself, all you got to do is just walk up and down the driveway a bit with your walker. Doesn't want to. He's just given up. And the same goes, here I have another neighbor. He has colon cancer, or he's in remission. He's out all the time. He's taking care of his brother. And I said to him, don't you ever think of how I can't give up. He says, my brother needs me. So he's got a reason, and they got to have a reason to keep on going. And a lot of them don't have reasons. They just, oh, my family says I can't do it, or my family says they'll do it, and I don't care anymore. Forget it. Have a reason. Do something. Use your head. Use your mind. And you'd be surprised at how much you can do. At least that's how I did.
And what tips for helping fall avoidance? Well, who's talking about that?
I'm sorry, I didn't hear you.
Right. We're going to talk about how to prevent some falls. Like you mentioned, building muscle is probably a very important component. Here's some other stuff we can do. Is it Morgan you talking about this?
Yes,
or Rad?
Morgan, go ahead.
Yeah, for sure. So there are like a bunch of risk factors for falls. I think it was actually found that like 1 in 3 seniors over 65 will fall each year, which is really alarming. But some things are like balance or low reaction time, or like sarcopenia, like Dr. Curnew was talking about, or low bone strength. And those are all like risk factors. And like we can do something about it. So like as Lynda was saying, like if you like find your reason and you're really motivated and you just like try, you can definitely do it. And there's a bunch of different exercises that don't have to be too hard. And yeah, I'm really glad that Lynda and Richard, you guys got like the support you need in terms of personal training. Is like, I know it must be like kind of overwhelming to kind of start getting into exercise, especially at more of an older age, and kind of learning how to do those exercises, especially if it might seem strenuous at first. But yeah, you guys really persevere for sure.
Yeah, well, Marco always says the next day, you're going to be a little sore, depending if he's doing things. And the first couple of weeks, yeah, I was sore. So was Rick. Rick, I'm so sore. I goes, yeah, that's from exercising. Like, one of the things we do have to worry about, and he, as I say, as I lost my brother-in-law just recently, and we keep an eye on my sister. Now, my sister has what they call Minner's ear, where she has problems with her balance. And I say to her, well, come over and stay with us and we'll have, and then I thought, with Marco going to come into the apartment, I'm going to bring her down and see if she'd like to exercise. Maybe he can figure out to help her keep her balance. Because right now she's doing okay, but that doesn't mean that something might not get an attack or something. And I'm thinking, that'd be a good idea. And I said that to her daughter-in-law, and her son and her daughter-in-law said, hey, that's a great idea. So when we get in, I'll call her and see if she wants to come down, and I'll tell Marco and see what he says. Maybe he can give her some balance, things to keep her balanced so she won't lose it. So otherwise, you just have to you got to use your brain. Don't let it go soggy. And that's one of the things.
Well, remember to, fall proof your house, get those loose rugs out of the way, get rid of the clutter, or don't go to my office, wear the right type of shoes. There's certain medication that can lower blood pressure more than others. So lowering blood pressure is a good thing, but if we lower blood pressure too much, we can cause falls and break hip. Many medications that we use for prostate, for instance, can actually lower blood pressure and have an effect there. So many things as well to think about this. And one of the things to realize is as you get older, get up slower. And just and use balance devices when necessary. And I think what you and Rick have done beautifully is that this personal trainer and this exercise, you are new people. And you guys are inspiring, and I just wish people will take a look at this and say, this could be me as well.
Yeah. You just need somebody who, I would say, understands more seniors than, say, young people, because if you get somebody who's young, they expect, you to do this, this, and this, because you're young. But when you get to a senior, they've sort of, as you say, lose muscle mass, they do things. And one of the things that they shouldn't do, and the exercise is great. I mean, it's not strenuous, and I feel good. Rick feels good, and actually, I've seen Rick since he's been doing the exercise. One thing I have noticed on Rick is his intake of food. It used to be he hardly ate anything after this all happened. Once he started exercising, I noticed he's taken a lot of food, but he's taking food that's he eats a little more than what he did before. And he's gained weight because I have to take him out and get him some new pants because they're too tight. And he bought a suit for our granddaughter's wedding, and he couldn't get it done up for my grandson's wedding. I had to go and find another pair of pants that he had for a long time, and he barely got them done up. But it helped him. The exercising is helping him. The exercises, not only his intake, but his walking. He can do all his bodily functions on his own, except for taking a shower. And after, and he eats fairly good. So, I mean, it's just a little common sense, and don't give up. And I know a lot of people, a lot of seniors I've seen with different things, they give up. And I think, why give up? Well, I'm over 70. I'm getting old and I don't really need to do that. And I just don't think I should do that. And I'm thinking, why not? Why not? I mean, when you leave this world, you ain't coming back. So get it all done in advance and so you can enjoy yourself. And then when you do die, and nobody can say, well, she just sat around and looked at the wall. This way, I mean, I've got right now in my front room, I've got about 20 quilts or more. And I haven't told Rick about the stuff under the house I got. So, I mean, the point is, don't give up. Do some exercise. Even if you walk around the block once or twice or 3 times, do it. It won't kill you unless you really want to die. And otherwise, I don't think people want to. But do something. Exercise. Don't go up and if you live in a house, go up and down the driveway and go around the corner, up to the corner, come back down. We have a swimming pool. I don't know how to swim. And personally, anytime I ever tried, I always seem to drown myself. So now I finally learned how to float. Now I'm moving out and leaving my grandson with the swimming pool. I'm
Nice.
coming over and walk around. I used to do water exercises. I enjoyed it. Rick used to come with me to water exercises. And the swimming pool. And now he says, I've never been in the pool. He doesn't remember being in the pool. He used to swim back and forth continuously. I can't. So come walk across the pool with me. It just may not be great, but at least he's moving and it's helping and it's keeping the joints moving. Now I got him walking around the apartment. I'll get him walking, even if I have to walk him to the Tim Hortons up the corner from under the apartment building. But you just got to keep your body going. Do some walking, do some running, do some whatever you like. Bicycle. I tried that too. And come think of it, I got a bike under the house. I better get one out. But the point is, don't give up. And exercising is one of the best things that we've ever done. And I would not trade. I missed Marco. I was 2 weeks without Marco, his wedding and then his honeymoon. And now he's coming in and I'm looking forward to it. And I never thought I'd ever say that to anybody. Even Rick's sort of looking forward to it. He doesn't say he does. Oh, I don't want him coming. I don't want him. Oh yeah, but when Marco shows up, guess who's doing the exercises? Rick. And that's not giving up. So that's it.
Nice.
Yeah, for sure. Yeah, so moving ahead a little bit. Yeah, speaking of your personal trainer, yeah, you told us how the personal trainer, Marco, he gives you individualized training. So you're talking about how Rick has like the 2-pound dumbbell and then you've got the heavier ones, but he comes in an hour. Yeah.
Yeah, he the other day our grandson was in visiting and he found the 2-pound and he wanted that and he's holding it in his hand and he got the second one and Rick was sitting there and he brought the one hand over to Rick and said to him, looked at him and handed it to him and Rick was showing him what to do with it. He just wanted to see if he could drop it. Now he saw the 5-pound ones and I just sort of took them off him. But I'll tell you another one, my cat's getting excited. He likes to chase the 5-pounder around because it's got round edges on. But I do use the 5-pound and I do find them heavy, especially when he has me go from the chest out with my arms on and back and forth. And every time he says, do 10, I do 10. And then he says to me, 4 more times, which means 40 or 45, do 15. Well, then times 3, that's 45. But the point is, I may not be happy at the time, but I'm enjoying it. I won't tell them that one because then they'll be really thinking they'll do something else. But it is good, helpful, and the weights are there, and they do feel heavy. And if he keeps it up, I wouldn't put it past him to put 10 pounds on my arms, and that no way. So I mean, as far as I'm concerned, what we're doing now, I'll keep doing it as long as possible. And when my daughter stops paying for it, I'll pay for it because I really not enjoy, but I do enjoy having it, doing it. And it's helping me to do things that I never thought my back really bad. It feels like it's burning all the time. And when he started the exercises, I don't feel that anymore. And that's really something because it really helps me a lot. Helps Rick, He can get out of the chair. Sometimes he's got to exercise that a little more. But we started a new regime where he goes for a walk. He goes to the corner, or he goes up and down the driveway, and I'll count it. And it's not like, it's just like the stairs, up and down, that's one. Up and down the driveway's one, up and down the driveway's two. And then if he wants to go to the corner, I'll walk with him. Otherwise, he goes up and down the driveway on his own, and I watch it, and I make sure he's there. And that's really helpful.
I like the fact that Richard's doing some stair climbing, and so are you, and you're going for your walks, using your pedal machine, your climbing stairs. It's fantastic.
If you had asked me in December when he came from the hospital if he'd ever do this again, the answer to you would be no. I don't think he'll ever get better, and he has. And I just tell him, keep going.
Fantastic.
And
good.
That's it.
I think you're the perfect.
Well, we'll
And-
keep going, and I got a reason to keep him going.
One of the things, so you're doing the
Yeah.
exercise. So one of the things that we're going to talk about is getting proper protein. So let's hear a little bit more about that. Tell us more.
Proper protein. Oh, I don't know.
I think Morgan and Rad is going to talk about that. Let's listen.
Okay.
So Lynda was telling us how Richard doesn't eat a lot, and obviously you're talking about how he eats some more now, which is like good to hear. But he limits his chips, eggs, cereals, and he does enjoy some sandwiches, raisin buns, coleslaw, meat, potatoes, and enjoys some Gatorade. But yeah, if you want to talk, Lynda, about like what kind of dietary changes you've made, if any, and how you get good protein sources.
Well, let's see, protein. Oh, I like to eat meat. I like to eat bacon, but not a lot of it. I love it, but I know to back off. I eat some eggs. I eat cereal when I have milk on it, and I have tea. Well, my breakfast would consist of maybe toast and jam, and a cup of tea or two, because I'm up at 6 o'clock, so I have a cup of tea then, and then about 8 o'clock I'll have another one, and then some mornings Rick will get scrambled eggs. He used to get them all the time, and then now he's eating toast. He likes raisin toast. He likes his sandwiches of a raisin bun with the meat on, and I as for me, I'll just whatever I cook, I'll eat. I was never a person that passed up food, any kind of food, but then I found out I was allergic to venison, and I had a friend whose father used to go out hunting, and I'm not a kind of person that I'll eat fish. I love fish. The only problem is do not serve it to me with its head and tail on, or fin, and then I'll eat the whole thing. I like.
I'm going to share something here. I'm going to I'm eating a lot of egg whites. So I get these cards of egg white. I'm going to have some right now. I just put this into a bowl. I cut off some vegetables. I don't have any right now, but what I'm going to do is just going to put in the microwave for 3 minutes, and I'm going to have a good source of protein with egg whites.
Yeah, we did. I did use that for a long time, but as I say, with him coming home from the hospital, it was things that changed. But he will eat the egg whites, and he'll eat salmon, which I was really surprised, and it turned out he really liked it. He'll eat tuna. He'll eat won't eat beef. He eats very little beef. Doesn't really. He says it doesn't agree with him. But if I make it and I don't tell him, and then he tastes it, and he knows it's beef afterwards. But he doesn't like. He used to eat a lot of pasta. Well, not no more. It was whole wheat pasta, and he doesn't like spaghetti, but he'll eat pennies. So I mean, it's just a little bit, but you don't fill up his plate. You just put enough on there that it makes him feel comfortable. There's always seconds, so he never has to worry. And when Sandra was living here, and her family, she used to make anything he wanted, and his favorite is, and God forbid anybody, meatloaf. And she would make him 2 or 3 big meatloaves, and I would cut it off, put a little bit of gravy on it, and some potatoes and some vegetables, and then he would eat this meatloaf. And he used to laugh because I won't eat the meatloaf. And so she'll say, here's something for Dad, here's some meatloaf for him. And I'm going, yeah, here we go again. And So he eats that, and then maybe say chicken the next day. He'll eat his chicken, but it's not a big chicken. It's a chicken breast, and it's skinless, and he'll eat that. And then he'll eat, say, something like some rice with it, and there's some a vegetable. So we haven't been doing a lot of vegetables because of the fact that we haven't been able to go and get some fresh ones, which I will do this weekend. And he'll eat. Sandra, she comes in, she brings in fresh fruit. So he gets fresh fruit, and he used to eat apples, but he doesn't eat them more. He says they're too hard. So she brings him in watermelon, or I'll get him some melon and some blueberries and some things like that, and he'll eat it. So I mean, we get what we can, and I drink a lot of milk.
So one of the things that I'm trying to do is that I'm drinking some skim milk, I'm eating some fish, I'm eating some nuts, I'm eating lots of berries. I have half my plate vegetables. That's wonderful. I'm trying to avoid things like Gatorade and all these sugar drinks and stuff like that.
Oh, he drinks Gatorade. Oh, he loves that stuff. So what I did was I bought the Gatorade with no sugar. And
Good.
to this day, and he still hasn't caught on, there's no sugar in it.
Nice.
And he
nice.
drinks it. And it
Okay.
does seem to give him extra. And I don't know what this was made for. I don't like the taste of it, but it helps him to. He drinks it, and I just try and put him in. What'd you
Yeah,
put?
the next thing you do, you have lots of supports in your life. You might have a big family and you have grandkids you want to be part of and things of that nature keeps it
Yeah.
going. Great. I thank your daughter for setting this up. I think she's a real saint. Children are close by, lots of support. The kids, the grandkids, all checking in and things of nature. Is that
Oh yeah.
longevity is associated with quality relationships, and you have a whole bunch of that. What's the next slide? Next slide, guys.
There we go.
okay,
Morgan's going to
so-
talk about some fall prevention exercises.
Perfect.
Take it away.
So, Morgan, tell us about fall prevention. I'm gonna go get my egg whites.
Yeah, so obviously, as we talked about strength training. But even if you don't really want some like exercise with weights, there's some exercises that you can find just online, just searching up like fall prevention exercises. So these are some they're focused more on like balance and coordination, I guess. And you don't have to do these like just standing. If you're scared of falling, you can do these along a chair or against the wall, or have someone help you. But there's things like heel lifts where you can do along the chair. You can like lift one knee up at a time, or you can alternate marching step by step, doing walking or heel to toe walking. And you can also keep a fall diary that you can bring up to your physician if it's something you're concerned about as well.
Well, he does get that marching step, but they have him stand up and he holds on to the walker. He have him lift up his feet all the time, and when he's sitting, he has them lift, but he sits them on like a kitchen chair. He doesn't sit on a regular chair. I should say, he does have him lift his feet up, each one at a time, and then he has them marching. And then when he does have him when he's standing up, he may ask them to stand with one foot a little bit off the ground, and then count to 3 or 4 or whatever it is, and put the foot down. Now lift the other leg up, and it has helped his balance. And it helps my balance because I stand in there and do it. I lay up against the wall and I sort of lift my foot up. So if I'm going to fall, I'll know for sure I'm going to go right another wall. So it's watching him and watching what's going on. I sort of got the idea, and Marco brings in sheets of exercises. This is what we're going to do this week. You practice all this. This is what's going to happen in the second week, and this. And one of the things is him marching up and down in his legs, but not like a real march. It's just lift your leg up, count to 3, put your leg down. Lift up the other leg, count to 3, put your leg down.
So, Lynda, a couple of things that you guys can try as well. That we talked about leg extensions, kneel curls, sits to stands are very important exercises that we should think about and curl, because we lose a lot of our ability to get up and things of that nature. So that's really quite important. Next slide, please. So these are all really important exercises you need to incorporate. Mental health, relying on a cat for emotional support. Tell us a little bit more about this, Morgan.
Yeah, for sure. Yeah, so Linda was telling us how obviously it was a very difficult time for her as well. Yeah, not only was she recovering from her own fall around the same time, but yeah, after Richard's concussion and his hospital stay, she had to take over a lot of the housework that Richard used to do. And she said she was relying on her cat a lot, her cat Louie, for emotional support and also crying a lot after the incident. But yeah, she says that now she's seeing the light at the end of the tunnel after like about I think 4 months of strength training. She's been strength training since April, and it's helped her mood and confidence as well.
Mm-hmm.
Next slide, please.
Yeah, and in terms of strength training and their relationship with each other, it's they've been married for 63 years, which is great. And they're finding that they're kind of getting back into the routine and supporting each other. And now currently they're in like the process of moving. Um, but yeah, it's great that you guys have something that you guys can do together for your health.
I've also got an object in my life. I want to beat my mother-in-law's length of marriage. She was married she was married 69 years. Her sisters all made 64, except one who made 71. Therefore, I want to beat them all. So I have to stay healthy, and Rick has to stay healthy.
Great.
Well, you guys have shown that we're a great transformation. But we thought we'd show some other programs that are available too. So sometimes people have their personal trainers, do them on their own, do them in the gym, do them at a walk-in center, senior center. Tell us a little bit about the McMaster PACE program. I think it's a wonderful program if you can get yourself into it.
Yeah, this is the McMaster PACE. So PACE stands for Physical Activity Center for Excellence. There's a bunch of different programs, especially targeted towards patients of different backgrounds. So they have the MAC cardiac rehabilitation for those with heart disease. They have MAC seniors for ages 55 plus. And for people who have lower mobility or concerns with that, they also have exercise programs specifically for people with spinal cord injury called MAC Wheelers. They have a program for adults with multiple sclerosis, also cancer survivors as well. And they also have virtual options if you don't want to come in person. The PACE program is, the facility is on the McMaster campus, but they also have virtual options if you're interested.
Mm-hmm. I'll look into it.
Yeah.
All
And
the kinesiology, gives you backtrack. It's run by the kinesiology department, and a lot of their students are just so wonderful. I think I have the best clinic in the world, or one of the better clinics, because I have all these young students as well, and the kinesiology students really make a huge difference at the McMaster PACE program as well. So take a look and see if that's something you want to do.
Yep, I will.
yeah, and this is the Wheels of Fitness at Flamborough Connects. So it's free exercise classes for older adults by seniors for seniors. So it can work on things like full range movement, balance and coordination, strengthening muscles. There's a bunch of different locations that you can check out if you visit their website or check out their if you email them. But yeah, there's a bunch of different exercises. Some use small balls that you can squeeze. Some have resistance bands or light weights, or just use your body weight. So it's definitely something worth checking out if you're interested.
Okay, I'll look around.
Yeah, and thank you so much, Richard and Lynda. You guys have a really inspiring story, and we really appreciated your thoughts and experience and sharing this with us. But yeah, I guess the big takeaway from this webinar is it's really never too late to start. No matter what happens in terms of your health, even if you think things are going downhill, there's always a light up at the end of the tunnel, as you were saying.
That's
And yeah,
great.
thanks for sharing your story.
Well, thanks for having us.
And thank you for all your insights. Today, I saw two people today, one who's 70 years of age, his name is Mike, and he does these mini triathlons, and I haven't done it in a couple of years with them, and he always beats up on me as well. And I saw that person who's 62 who can only do just over a minute of activity today, who gets dizzy just walking around. So I think you have to decide what you want to do. And Lynda and Richard, you took matters into your own hands. You had the support of your family, and you have this Marco, your personal trainer, and you have to decide what you want to do. I want to grow old and age as much as I can. And you've done a wonderful job. And Thank you for sharing your story.
Thank
Brad,
you very much for having us.
oh, Brad, anything else that you wanted to add to this?
I just want to add one thing about personal trainers. I wish they were more accessible and more affordable, but I was telling Morgan and Linda about this before we started. I think a lot of people who have not started in the past, even if the cost is a barrier, I would think it's an excellent idea to invest a few $100s, and just learn the trade, learn some techniques. For example, if you are gonna do it on yourself, if you feel confident, you feel it's gonna be safe doing it, go ahead and get started. But try to get help from a personal trainer, learn the tips and tricks and how to do it, correct form, how to prevent injuries, and then use them as needed. Again, especially if cost is a prohibitive factor for some people, and so just get started from there. And if that's not something you're not looking forward to do, there's YouTube videos where you can follow along, put it on your tablet, put it on your TV, grab 2 weights, grab 2 water bottles, and do whatever you can. So I think my takeaway is do something. And as Linda said, a lot of people don't want to. The reasons are, multifactorial, right? People have the reasons, but there's a lot of people who have access, who can have access, and who don't. So we just want to make it simpler for people. Do whatever you
Yeah,
can
the other thing too,
and go from there.
I think
And
it's go ahead, Linda.
to say, you can call the city and ask if you had, ask for the recreation and tell them what you want. See if they have classes for seniors who to exercise. And, it might not cost you more than say $50 or maybe, I don't know what it would cost. But the point is, try the city. They might have free classes and you can go there too.
There's all sorts of options available, and for those who want to, we have our 3M mindfulness meditation movement that meets every Wednesday. And the cost of this one's really expensive. It's cost $0, and just a smile. And so that's important.
Mhm.
Anything else you want to add there, Morgan?
No, that's great. Yeah, I'm super inspired, and it definitely motivates me to work harder. Hopefully train for the CN Tower. I did go up the CN Tower. I went up 1776 stairs at the gym, but that needs to increase after hearing Linda's story. So yeah, thank you.
Okay.
Yeah, Linda and Richard for being a good example. I want to thank Morgan and Rad for putting all this together, and I hope hear more of your stories on how you're getting stronger rather than weaker.
Yeah. Well, we'll talk to you in January and then we see you after that. So we'll see how much progress Rick and I have made so when we come to see you in person.
Alrighty. Should we end with push-ups again today? One more time?
Sure, go ahead.
Okay. All right, let me see now.
I'm gonna do squats instead because I have to keep an eye on YouTube.
In the squats, I'll do the push-ups here. So here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3,
Last lap, go ahead.
4,
2 more.
5, 6.
There
Okay,
you
we got
go.
the point. There you go.
Dr. Curnew, in running, there is that last lap, and you hear the bell, and that gives you extra motivation. So just think about that every time you're on 24, and that pushes you to 26.
Right. And I want to thank everybody. And
Thank you.
is that we're going to talk about too is getting the right medication. So Morgan's going to take our lead about that. She's going to be contacting you about your medications. You're going to hear more about that. Join our groups Tuesdays about weight reduction, Wednesdays about mindfulness, and just be healthy and be a little bit healthier.
I'll do everything I can.
And good night, everybody.
Good night.